All right, so let's come into the control room. So the control room operates each of the rooms. So each of the cubicles corresponds to a simulation room. There's the 3 pediatric rooms, the 3 adult rooms, and then we have the birthing or OB room suite, and then we have an OR suite. So the way this would work is one computer screen would be for the mannequin, one computer screen would be for the patient monitor, and the other one would be the audio-video view from the cameras.
And you were telling me that the faculty can actually use the microphone and speak to the students.
So the faculty will be sitting here. There are speakers in the room that they would speak for the patient, answer the questions that the students ask, give their presentation. We can change their voice if necessary with a digitizer. So we have male, female, elderly, young, whatever we need to do, we can do that.
Cool.
We have additional debriefing rooms down this hallway, and then back in this hallway is the adult side. We'll have the OB suite and the OR suite. Everybody's working feverishly around here trying to get the building finished for the opening events, but here's one of the adult rooms. Looks much like the pediatric room on the other side, except with our adult mannequin. We have a surgery or a suite, or we could have this as a big ER setting or a trauma bay or whatever we need it to be, kind of a multi-use room, much larger room than the other side.
Awesome. We are putting the finishing touches on the building.
Putting the finishing touches on. So this room is the OB room. So this has the birthing simulator and the neonate simulator as well. So come on in. And this is one of our newest mannequins. This is Lucina. She's a high fidelity mannequin that will give us much more lifelike presentation of OB, both normal delivery and emergent deliveries.
You said this is one of your newest mannequins that Children's Miracle Network and Laura W. Bush Institute both helped us to get?
This room is a generous gift from those 2 fine facilities. And the students, you know, these are most vulnerable patients that they take care of. They have the lifelong, you know, catastrophic events, and practicing and learning on this type of environment is much safer for them and the patient.
Great.
So we'll go over here to our clinic exam area. This is where students can practice in a clinic setting. So we know that the best training that we can provide for student learners in healthcare is with a real patient. So we have on this side, we have what is termed a standardized patient, which is a person that we give a case to, and they learn the case. They learn how to present the case. It may be as simple as knee pain, but it may be that they're getting ready for a surgery consult. So they would be in here. The student learner would come in, interact with them. They learn to communicate. They learn to take notes. They learn to do the communication and assessment in an organized manner and in a timely manner. And then we have, you know, we can record in here. The faculty can grade. They also can work with the student on improvements if they need it. So this is a new area for us. We have up to 12 rooms here, and we're pretty excited about it.
And so these people, they really have to learn how to feign a certain illness, don't they? So that the students can diagnose them, right, quote unquote.
Yeah, the standardized patient receives a whole case from faculty, and it has everything from past medical history to meds that you would currently take, just basically exactly as you would if you were going to see your physician. But they're learning a specific case that the student should come to the same diagnosis as they would if that was a real patient, not somebody that was just standardized patient. So it's very important that they learn that case and they present at the same time each and every time, so the students all learn the same.
Interesting.
So the computers on the outside are for the students. They would have their patient interaction and they would come out and they would do their notes. So they would type their notes, they would submit their notes, we would print them off and give them to the faculty, or the faculty can grade them later if it was for a final assessment. And we're really excited in the new building. The School of Pharmacy comes in and they're going to start doing some activities with us. So this area down here is their mock pharmacy. So they will be able to look much like either a clinical or a retail pharmacy. They'll be able to do patient teaching, just as they would if you went to a local retail pharmacy and picked up your medications. So they can learn to interact, they can learn to give correct information, timely information. The faculty can help them because we have videos and cameras out here as well. So,
and so would these be standardized patients also that would approach the windows?
They certainly could. They could be standardized patients. They could be fellow classmates that they're just learning to interact with. That's kind of the nice thing about this building is depending upon the level of the student, we can kind of match that to help that student get to the point they want to when they're final and ready to go out into the public.
Excellent.
You gotta have Justin look that over before you. What else you gonna look at?